Well, welcome everyone. Happy Monday evening, where you are in the country. Thanks for joining us. My name is Harry Brule. I'm a board member of NEA BPD, and it's a pleasure to welcome you to this webinar. For those of you who don't know, the National Education Alliance for Borderline Personality Disorder is a nonprofit organization that provides education, raises public awareness and understanding, decreases stigma, promotes research, and enhances the quality of life for those affected by borderline personality disorder and related problems, including chronic emotional dysregulation. We have the largest virtual resource library online with information related to BPD. We bring together clinicians, researchers, people with lived experience, and family members at conferences around the world. Our signature program is Family Connections, which is a 12-week course for caregivers of individuals with BPD to learn psychoeducation skills and receive support. We also have a course for parents in distress due to their child's previous suicide attempts, self-harm, or other dangerous behaviors. And this is our Managing Suicidality and Trauma Recovery course. We also are heavily involved in advocacy work that focuses on 3 goals. The first is increase insurance coverage for BPD treatment options and emotional regulation treatment. The second is to reduce stigma around borderline personality disorder. And the third is to educate key audiences about BPD. And tonight's webinar is part of NEA BPD's efforts to support individuals and families to obtain insurance coverage with or for BPD treatment. So a few housekeepings that I think we have on the screen. The program is being recorded and will be on the NEA BPD website. Your video has been disabled and all participants are on mute. Please submit your questions on the Q&A. So there's a chat and a Q&A. The chat, I think, is disabled, but you'll want to put questions in the Q&A, and Joe says he'll have time to answer questions as we go along and at the end as well. So stick them in there and we'll do our best to be moderating those questions. And there we go. Presenters and panelists will answer as many as we can with the time allowed. One note about the questions is please keep them specific to Joe's topic, as this isn't the forum to ask for advice for a personal situation you may be experiencing. The opinions expressed today are those of Joe. They are not necessarily represent the views of NEA BPD. The webinar is not intended to be a therapy or a substitute for therapy, and we do not intend that anything said will be triggering, and we ask you to exercise self-care. If you do find something triggering, please sign off immediately and tend to your needs. 988 is available in the US 24/7 as a resource. And please reach out to your mental health provider or support system if needed. So Joe Feldman began advocating for access to mental health care after overcoming denials for a family member's care, including with a successful federal lawsuit. His advocacy work has included policy-driven discussions with legislators and regulators, a board role with the Kennedy Forum, Illinois, presentations to parent groups, and publication of actionable guidance such as the 2021 article in the Journal of Psychiatric Practice on medical necessity letters. He is the founder of a nonprofit organization called Cover My Mental Health. And before I send it over to Joe, I just want to give a big thank you to Eric Kunish, who just joined us, who is the connection that got Joe Feldman connected with NEA BPD. So thank you, Eric. Joe, thank you so much for coming on, and we're super excited you're here, and I'm going to turn it over to you.
Great. Harry, thanks so much for your introduction, and Eric, thanks so much for your collaboration over now these many months. I'm really delighted to be here this evening, and we'll get started here in just a second. All right. Can I get a thumbs up from someone that these slides are visible? All good. Great. So As Harry mentioned, I've been involved in advocacy for several years, and it came out of an experience that I'll say did not plan or anticipate, which was one of our children needed some substantial care beyond what we were able to provide here at home. And not long after they arrived in residential care, we got a message from our insurance company that said it's not medically necessary and we're not going to pay for it. And I had anticipated that that might be coming on the advice of a friend. And our family had the means to maintain the treatment and to deal with the insurance company later, which I certainly recognize is not everyone's good fortune. And we did deal with the insurance company later by, as Harry said, filing a federal lawsuit ultimately, which we won in the Northern District of Illinois. I learned a lot from that experience, probably most significantly that litigation is a horrible way to go, and that appeals are not necessarily even a great place to start, that there are a lot of other steps that can be taken. So it was just over a year ago that I founded Cover My Mental Health, with the express goal of helping families, patients, and also clinicians to have access to resources and ideas that can help overcome insurance company obstacles. I also like to say that we do that after first providing encouragement that you don't have to take no for an answer, and that the resources and the ideas that we provide can at least level the playing field. We were talking a little bit before we got started tonight, and I said I wish that we could wave a magic wand and make all these troubles with insurance companies go away. It's not quite that simple. I do think, though, that evening the playing field and establishing for families and clinicians the decision making that's appropriate to the care of a loved one or a patient is exactly what we should be doing to get access to care. So I want to organize the discussion this evening around just the basic expectations of what we think about, if we even think about it when we have health insurance. So I would say the average person gets health insurance, maybe through work, maybe otherwise, and it really doesn't ever occur to them to think about what that actually means. I've tried to articulate here just a very simple look at what we might expect if we thought about it a little bit. And I'm guessing that for the folks on this call, these are observations or expectations that you've thought about quite a lot. First, we expect that if we're in an insurance network and we're dealing with an insurance company, that we're going to be able to identify the appropriate clinician. And we'll talk about what are the dimensions of what's an appropriate clinician. And then we'll understand what's covered, which basically is going to be if the clinician who is the right one working with us says that we need a certain medication or a certain course of treatment, that's what should be covered. And that as we progress through the treatment, there might be changes, there might be higher levels of care, low levels of care, just different approaches, different medications, that also will be covered. And that the claims are going to get paid. Now there'll be deductibles and there might be copays, but fundamentally the care is going to be covered. And if there's any disputes, they'll be resolved with the patient in mind in terms of the care that they need. Now, if these expectations were all met, as a matter of course, we would not be here today, and I wouldn't have started Cover My Mental Health. But these expectations are not met, and it was I'll say that observation and experience that I had, and just a really terrific group of experts who've been helping me along the way to identify resources that can be used to push back on insurance companies. I'll say behaving badly. This is a screenshot of our website, which is at covermymentalhealth.org. So here's how we approach thinking about helping folks with these insurance company obstacles. As I mentioned, the first thing that I think about is encouragement, which is to say you don't have to take no for an answer. that there are steps that can be taken that are, I'll say, as accessible as possible. We try to make things very, I'll say, common sense based. We provide a number of tips for success. I'll talk about a few of those in a few minutes. One of the things that you won't find on Cover My Mental Health is a big explanation of how the law is on your side. In many cases, the law is on your side. Um, at the point of crisis, though, when you're trying to get care for a family member or even for yourself, knowing that the law is on your side is just not very helpful. And we just don't spend any time there. We try to provide resources that are, I'll say, unburdened by whether the law being on your side makes a big difference or not. It's just too slow an approach to take. Um, Second, we really try to focus on, well, what's the obstacle? What is it the insurance company should reasonably be doing based on our reasonable expectations? And how can we engage the insurer directly related to that obstacle and deal with that on a very, again, common sense base, um, so that we can hopefully remove the obstacle and move things forward. And then there might be additional steps that are helpful and maybe even required that uh, that need to be taken and can be taken. I call these, if at first you don't succeed, then maybe some of these steps might be helpful, and we'll talk about a number of those towards the end. So this is a second screenshot, and by the way, I promise this will be the last screenshot from our website that you'll see. We identify a number of tips for success that are, again, intended to be encouraging for how dealing with an insurance company can be, I'll say, less challenging than it needs to be. And I want to just talk about maybe the first two. Um, in the tips while talking to insurance company customer service reps, the key points are to take notes, to write down what you've heard, who you've been talking to. Um, and we include in this part of the website a video that gives some specific, I'll say, coaching about how to deal with customer service reps who ask clinical questions. So I've had this experience on my own where I was on the phone with our insurance company, and the customer service rep said, "Well, so by the way, how's your child doing?" And I said, "What do you mean?" And they said, "Well, like on a scale from 1 to 10, how do you think they're doing right now?" And I said, "Well, I'd say a 1." And they said, "Well, why 1? That's really, really low. Why do you say that?" And I said, "Well, because right now my child's in a residential program, so sort of by definition they are at the low end on a scale from 1 to 10. Um, the real answer should have been, why don't we leave this to the clinicians? This is not a conversation about clinical care or clinical status or clinical progression. We really should leave this to the clinicians, and that's, I think, really important counsel. Um, Describing the clinical status to a customer service rep is only going to work against you. The second tip that we talk about, and this is, I think, is going to be super well known to this group, but I certainly like to point this out, especially when I'm talking to clinicians, is that every health insurance policy provides for an authorization where a patient can delegate authority to a friend or family member or a parent to deal with the insurance company. Now, this can also be done through a power of attorney, and certainly for adult children, having some documentation, some authority is going to be required. That can be also done through, I'll say, through the court system. But the point of the matter is, individuals who are in the middle of a challenge, even parents of individuals in the middle of a challenge, may want to take advantage of authorizing someone to help out, and completing one of these forms to authorize someone to be helpful with an insurance company may be the answer to the question, when you're in the middle of the fight, and a friend or family, friend or a neighbor says, is there anything I can do to help? Can I drive the carpool? Can I run to the store for you? It could be that for for the right person, the answer is, you could really help me to deal with some of this insurance company administrative uh, crap that's just a little bit more than what I can take on right now. So let's talk a little bit about that first expectation of being able to identify an appropriate clinician. So when you sign up for an insurance plan, there's very likely a clinician directory of who's in network, and that's supposed to be their way of connecting you to the right resource. And the right resource should be a clinician who has expertise relevant to the care that's needed. And it could be that it's a step from a primary care physician or from a psychiatrist to someone with a higher level of experience or a more specific level of experience. But we know that having competent care is a very reasonable expectation. And then also, very pragmatically, the clinician should be close to where you are, and you should be able to get an appointment soon. So what are close and soon? Well, sometimes state law or even health insurance policies will say, we commit to provide you with a clinician within X miles or X minutes of driving from where you live. And you might be able to find that information. I like to think that you'll know what close and soon looks like if you're in I'll say Manhattan, 10 miles away could be 2 hours. And if you're in a rural location, 10 miles away could be 8 minutes. So I like to worry a little bit less about exactly what close means. I think you'll know it when you see it. And in terms of getting an appointment soon, if it's an emergency, soon probably means today. And if it's not I'll say a matter of life and death, soon might be a week, maybe it's 2 weeks, but we know it's not 90 days or 6 months. That's just not right. And the goal of I'll say the basic expectation of a relationship between someone who has insurance and the insurance company is they're going to provide you the directory, and you're going to be able to use that to identify the right clinician. So what happens when that doesn't work? Well, one of the resources that we offer on the website is this downloadable worksheet. And the idea behind this worksheet is to be able to show that you've done your homework, that you have used the directory to contact either by phone or by email or whatever, maybe by a messaging platform, clinicians in search of an appointment soon with the right clinician. And if you are successful doing so, then this expectation is met, and you can, I'll say, proceed without any issues. But when you have called 5 or maybe 10 or some other number of clinicians, and all you get is nothing, then being able to show that you've done your homework may be quite helpful. And the worksheet that we provide here gives you the opportunity to document that you couldn't get anybody to answer your message, that they're no longer in network, that they're not taking new patients, that they offered you an appointment in, I don't know, summer of 2027, and that it's just not working. And this is I'll say, first step to be able to document, I've done my homework and now the insurance company needs to do theirs. And it puts you in a better position to say, please find me an appointment because I have not succeeded on my own, or I want to have access to care out of network since the network that is offered to me is not sufficient. I'd say the good news around this concept of so-called network adequacy is that there is more and more attention being paid by state regulators, and there are more and more stories in the press about this. And as much as I said, I don't want to depend on the law to resolve this issue. I think there's more and more sensitivities by insurance companies that having a network directory that should be filed under science fiction as opposed to under community resources, that's just not going to work. So let's talk about these next two expectations that were featured at the top. So understanding your insurance coverage. So your expectation is, I'm not going to be surprised. So when I find a clinician who is taking care of me or taking care of a family member, and they determine what the right course of treatment is, probably in consultation with the patient and their family, um, that should be covered. It's just not remarkable. And the assumption is that the clinician or clinicians taking care of the patient have the best vantage point for making decisions about what clinical care is required. They have the training, they have the expertise, they're mindful of what sort of care is going to be in support of the patient, um, supporting their recovery, or they're maintaining a standard of living, um, and that expertise should continue to apply for as long as the treatment is necessary. So why is it that sometimes insurance companies and and clinicians are not on the same page when it comes to this determination? Um, so this simple graphic, I think, might help to shine a little bit of a light on there. So you may have heard the term medical necessity. It's a term that shows up in, I'll say, every health insurance policy I've ever seen. And the insurance company, in their insurance document, will say something to the effect of, we will cover medically necessary care. So medical necessity is really a legal term. It's not a clinical term. On the left side are some representations of how clinicians are trained. So do no harm, the Hippocratic Oath, that's been around for almost 2,500 years. Clinicians are taught to use safe and effective care. And probably most importantly, they're taught what are the generally accepted standards of clinicians like me, uh, who are taking care of patients with BPD or with depression or any other medical condition. So the the problem of what's covered and what's not covered is most likely to be found when generally accepted standards, which is a clinical term, it's how clinicians are trained, and medical necessity, a legal term, when there's space between those two. And so removing any of the space between those two becomes an extremely important step to be able to overcome a potential gap between what the insurance company is saying and what the clinician is saying. So Harry mentioned at the beginning this article that was published 4 summers ago, summer of 2021, in the Journal of Psychiatric Practice, entitled "Providing a Routine Medical Necessity Letter to Improve Access to Care for Our Patients." And my co-authors are really just rock stars in this world of improving access to care. Mark Dubofsky is a litigator in this area, and he focuses on mental health and substance use disorder care, as well as disability work. Eric Placken, until December when he retired, ran the Austin Riggs Center in Western Massachusetts. And Cheryl Potts is a longtime advocate for mental health care access. The whole point of this article was to teach psychiatrists and other clinicians about medical necessity letters. So what is a medical necessity letter, and why is it important, and how to write one, and how to close the gap between this notion of who gets to decide what's medically necessary. So this image on the left side is the downloadable template for a medical necessity letter that you can find on our website. The contents of it are, I think, pretty much common sense based. If you think about a conversation between a clinician on the one side and an insurance company on the other, trying to sort out, okay, what's the right care, what's the appropriate care for this individual, and the clinician would make the argument as follows. They would say, let me tell you about my training and let me tell you about my practice. What am I expert in and what am I trained to do? And then there would be a discussion about this particular patient and what the assessment is of this particular patient. Again, based on the practice and experience that makes this an absolutely reasonable decision for the clinician to be making. They'll talk about the specific generally accepted standards of care that have been relied on. And there are a number of different standards that are applied across different parts of mental health and substance use disorder care. And our template provides a listing of some of the most important ones that can be selected for inclusion in a final document. And then there's a discussion, really a brief discussion of how those clinical standards were applied, and with the conclusion of the medically necessary care for the patient. So I spend a fair amount of time talking to clinicians and describing the different scenarios where a medical necessity letter can make a difference in this, I'll say, disagreement based on different standards between an insurance company and a clinician. I can also say that in cases for both of our kids, we've had care that was denied, and we had a medical necessity letter from a treating psychiatrist or other clinician, and having that letter in hand and put it in the hands of the insurance company was crucial in overcoming the denial and getting the coverage that we paid for. So you can also find a really great, I'll say, testimonial on our website from a psychologist who runs the Lindner Center of Hope in suburban Cincinnati, where he describes the use of a medical necessity letter to overcome an insurance company dragging their feet about care for one of his patients. So what about claims getting paid? Well, again, the assumption is, the reasonable expectation is, I'm not going to be surprised. So yes, there'll be deductibles. Yes, there'll be copays, but I know about that. The rest of it should be covered by the clinician who I found in the network directory and who has been taking care of me along the way and may have provided me with a letter of medical necessity to close any gap between what an insurance company or their hired expert on the side might be thinking is appropriate. I'd say every insurance policy I've ever seen has one step that you can take to resolve disputes, and that's a formal appeal. And I'd say in an emergency, so if there's a dispute in the case of emergency care, where a clinician maybe needs to make a decision about having someone be taken care of on an inpatient basis or residential care, and they call the insurance company, and the insurance company drags their feet, that's where an appeal might be the right initial step. I would say in other cases, there are so many other steps that might be taken that filing a formal appeal may not be the way to go. And we'll talk now about what some of the additional steps are that might be taken in that regard. So we've talked about already two of the steps that you might take before an appeal. One is having a medical necessity letter on file, and the other is the worksheet of, I can't find a provider in my network and I tried. This is another step that is extremely important. And I can also say I've done this twice, and both times it made a huge difference. And the idea is this. If you're trying to figure out what is the insurance company thinking anyway when they are dragging their feet, they're denying care is not medically necessary, they're not giving me a prior authorization that is appropriate. What's going on over there? Well, you have the right to find out by filing a request for a copy of the entire claims file. It turns out that on a federal level, this is part of HIPAA. So HIPAA we think of as the law that says you can't disclose any private health information except as approved by the patient. But it turns out that another of the provisions within HIPAA is that you can make a request of the insurance company that says, I want a copy of everything. I want a copy of every record that's in my file that you have. I get to have it, and the obligation is that they must turn this over to you in no less than 30 days. Um, the image on the left side is a template letter that you can download again from our website. So you've gotten the gist of how my brain thinks, which is if there's a problem, there's probably a template draft letter that can be added to the website. And this letter says basically, I want everything in the file, and then we list, I think it's 6 or 8 different items that fall within all, in case all needs to be clarified. One of the things that I found most interesting when I have made this request is you get copies of call logs. And so we all have experience with being on a customer service call where we get the message, this call may be recorded for training purposes. Well, these call logs may also be recorded for documentation in an insurer's file, and you're entitled to those. You can get those. And it was in the case of the first dispute that I had with our insurance company that I made this request, and I got a copy of, among other things, the call logs. And those call logs included information that showed that the independent psychiatrist who was opining on our child's status had made just blatantly false statements about a conversation that they had had with our child's therapist. And that information was extremely helpful, along with the medical necessity letter, to show that the insurance company had not properly assessed the claim. And that was, I would say, a big part of our overcoming the obstacle. The other time that it was helpful was when the insurance company had said that our other child's care was not medically necessary. And one of the documents that came through, again, series of call logs that showed on, I think it was 6 different occasions, the documentation, the internal insurer documentation saying that the care was medically necessary. So the idea that the explanation of benefits said something different was just wrong. So when those 2 documents didn't line up, it was, I'll say, an important step to be able to overturn part of the denial. Here's another step that's possible, building on, say, a medical necessity letter or a worksheet, or maybe even the claims document, and that's something called a formal insurer complaint. So let me first say what it isn't. It isn't a regulator complaint, and it isn't a formal appeal to an insurance company. It's a formal complaint. I learned about this from a friend of mine who used to run the behavioral health clinic, or the behavioral health unit of 3 different health insurance companies. He now works for a nonprofit and is still involved in dealing with insurance companies, but I'll say he's now working for the good guys. And he's the one that first told me about this concept of a formal insurer complaint. And I've been able to discuss it with quite a number of other former insurance company executives, as well as litigators and regulatory folks, to learn a little bit more about this particular step. So as our website describes, there are some really, I think, pretty easy to use statements to say to a customer service rep. This might be and documented later in writing. This might be, for example, after a medical necessity letter is submitted and the insurance company says, we're still not covering this. It's still denied. Well, the message is this: I want to file a formal complaint, and the complaint is for a quality of care failure. And then you explain the quality of care failure. It could be according to the medical necessity letter submitted on March 3rd, and there's been no change in the status. You guys have got it wrong, and I want this to be corrected within 72 hours. And then you document it in writing as a follow-up. So why might this be helpful? Well, it turns out that when insurance companies get formal complaints, they are obliged to do two things. Um, and that is they are obliged to notify their regulatory authority that they received a complaint and what the disposition of that complaint was. And they're also obliged to report this to their accreditation organization, which is most likely a group called NCQA or another called URAC. And the notification probably doesn't happen until the end of the year. But what happens the moment you say it is they have to keep track of it. And by virtue of them having to keep track of it, it ends up, I'll say, in a different work stream within the insurance company that could get attention in a way that other actions, like may I speak to a supervisor who might be just a more senior person who tells you the same thing the other person did. This triggers a different mechanism for them to have to keep track of what they're telling you. And if you've already filed a medical necessity letter and you've done this, it may be quite helpful. By the way, it also might be helpful later with an appeal to be able to say, I filed a medical necessity letter, and by the way, I filed a formal complaint for a quality of care failure, and that didn't do it either. It's one more very discrete, identifiable, and I'll say relatively easy step to be able to take. There's not too much that's legalistic about doing this. So there are some government resources that are potentially helpful that you may know about or maybe not. So state and federal regulators provide support when people are running into challenges with their insurance companies. And our website provides links and phone numbers to the federal resource, the Employee Benefit Security Administration, as well as to state regulators. I would say those are steps to take. They're not fast in all likelihood, particularly for complex matters, but they might be helpful nevertheless. But I'll tell you the one I really like the best is constituent services. So every elected official, or let's say pretty much every elected official at a state and federal level, has someone on their team whose job it is to deal with requests from constituents. So this is certainly the case for members of the U.S. House of Representatives or the U.S. Senate, and may very well be the case for members of the state senates or state assemblies or House of Representatives. And calling up a constituent services office to say, here's the problem I'm having with my insurance company, and I'm wondering if you can help me. And here's what I've already done. For example, I've submitted a medical necessity letter. I filed a formal complaint for a quality of care failure, and I'm still not getting anywhere. Can you help? So I was at a conference in El Paso. Eric was in the room for this, by the way, and I was describing this particular resource of calling constituent services, and a woman in the room raised her hand sort of really vigorously and said, "This is exactly right. This is my job." She said, I work in the Texas legislature for a representative, and I take these calls from constituents. She said, I've had my own challenges with mental health. I've had my own challenges with insurance companies not covering my necessary care. And when a constituent calls and they tell me, here's what I've already done to help myself or a family member, she said, I love nothing more than being able to help them by calling the insurance company and saying basically, why are you standing in the way of care for one of my constituents? So I was, I'll say, surprised and delighted to hear her validate the idea. And afterwards, I asked her if I could take a video of her explaining how this works, which she readily agreed to. And that video you can find on our website under the constituent services section. She's just the most earnest, helpful sounding sort of immediately person that you'd want to have on the other end helping you out. So for these If at first you don't succeed steps, we've talked a little bit about the few items at the top. Um, and the first one, regulator complaints, those are certainly important. Filing a formal appeal is certainly a step that might be taken. Let me see if I've got. Yeah. So let's first talk about appeals. Um, and I should say, and this might have been a disclaimer at the top of the show. So in addition to all the other disclaimers that Harry mentioned, I'm certainly not providing any legal advice. Um, a lot of our resources, well, really all of our resources have been vetted uh, by experts, including legal counsel. But in terms of any specific state or plan, we're not in a position to do that. Um, when it comes to appeals, there are a number of things that are just really, really important. And I think um, insurance companies tell you if you have a dispute with us, file an appeal. Here's the address. Be sure to send it in on time. That's all they tell you. What they don't tell you is it's really a legal process, and that it could be your one and only chance to provide um, documentation, evidence of what's going on and why you think they got it wrong. Um, there are a number of different resources that you can find on websites from advocacy groups. I've even seen one that says, uh, be brief. And so I would say that's definitely not good advice. Brevity doesn't count, completeness counts. This is your opportunity to include everything: copy of the insurance policy, copy of every explanation of benefits, include it all, because depending on the state and depending on the policy, it could be that the evidence that you submit in the appeal is all that will be considered when that appeal is considered. Um, uh, and appeals can be, they can be successful, certainly. Probably not the fastest, but they certainly can be successful. And um, when the other steps that I've talked about don't work, this may be the way to go. Single case agreements is probably an example of a path that many of you have encountered, but there's certainly a lot of folks who are looking to access care who are not familiar with this idea. So, single case agreement is a term that's used by insurance companies that basically means we're going to make this one-time exception only. We're not going to agree that it should have been covered or that it wasn't covered. We're just going to agree it's covered this one time, and it's going to be a sort of a separate document. Um, there are certain clinicians. It turns out eating disorders is one where these are relatively routine, which sort of make you wonder, if it's so routine, then why isn't it just covered? But single case agreements, typically it's something you have to ask for. You're not going to be likely to find in an insurance policy, the process for requesting a single case agreement. Um, we do have another of the downloadable templates on the website, a letter that outlines a request for, please tell me the process for filing for a single case agreement. Um, the documentation around that's going to vary with each insurance company, and they probably will have a standard form. Um, and it could be that your clinician can help. It could be that your employer can help if you have an employee-based plan. And to be sure, you're going to have to ask. There's just no, there's going to be it's almost unimaginable that that an insurance company is going to say, why don't you ask us for an exception under a single case agreement and then we'll take a look. It's just not likely. So what about litigation after all? Um, so as I said earlier, litigation it's just a terrible, terrible way to go. The the law that that all employer-based insurance is regulated under, which is been around for more than 50 years, called ERISA, the Employee Retirement Income and Security Act. Um, it's just very, very hard for um, for patients and their families to sue insurance companies under this law. And when you drive down the highway, at least I'll say when I'm driving down to see friends in who live in Indianapolis or Cincinnati, and I'm driving down the highway in Indiana, it's just one billboard after another of, call, if you were injured in a car accident or a truck hit you or whatever, call this attorney and they'll help you out. Now you'll notice that wherever you might be, you don't drive around and see billboards that say, if your health insurance company denied you care, call us and we will go after them. You just don't see that. And it's because the law that governs these health insurance plans does not provide for any kind of penalty or extra damages to make it worth the while for lawyers to go after these cases. There certainly are ways for them to recover their time, but it's not like it's not like a big personal injury sort of industry at all. So there are a few examples here or components of what I called a recipe for a successful lawsuit. I think the one that's really most important here is if you have a dispute and you think the insurance company got it wrong and you've done all these other steps and you've filed an appeal, which is probably required before you can even consider litigation, you got to find an attorney who actually knows how to litigate this work. And there are, I think, maybe between 8 and 10 litigators in the country who are competent in this particular part of the law. So it's a very, very specialized sort of activity. So hopefully one of the other steps will get you there first. So a few takeaways, and then we'll open it up for questions. So your reasonable expectations about what health insurance should do for you are completely reasonable. There's nothing remarkable about them. Our website provides first and foremost encouragement and then resources that you can use today. And as I said earlier, we don't rely on the law being on your side and needing to delve into the details of either federal or state law. We certainly have developed our resources with those in mind, but getting started doesn't require that at all. Medical necessity letters are, I think, the absolute best way for a clinician to assert their authority over the patient's treatment. By the way, one example that I talk about with clinicians that I didn't mention earlier is prior authorizations. So it turns out that even when you have a prior authorization, it's still a good idea to have a medical necessity letter on file because it documents concurrent with the prior authorization that we're all on the same page. And it mitigates the risk of an insurance company going back and saying, actually, we changed our mind and the prior authorization that we gave, we're not gonna honor that, which is an experience that I've had, and having a medical necessity letter on file mattered in pushing back on their trying to flip-flop. There are lots of different advocates that might be available to help patients and their families. We talked about authorizing someone to act for a patient or even for a family member. Government, both regulators and elected officials. Didn't really talk about employers too much, but employers more and more are, I'll say, visibly supportive of the mental health care of their employees. And while stigma is still, I'll say, a relevant matter, it could be that in the right situation, going to an employer obviously for an employer-based health plan and saying, I really need your help. This insurance company is not meeting the basic expectations of covering the care that either I or a family member need. And then we've talked about actions available if at first you don't succeed.